want me just to get started?
No, sorry. Technical difficulty. Sorry about that, everybody, and good afternoon. Welcome to the Ottawa Business Reopening Workshops for Personal Services. My name is Lynn Ladd, and I'm proud to be the Director of Membership and Programs at the Ottawa Board of Trade. You may know that just for a second, just going to mute one of our guests.
I'll show you later.
Figure out which one it is. There we go. Okay, sorry about that. We'll get back to that. The mission of the Board of Trade is to create prosperity through advocacy, collaboration, and leadership. We represent all businesses in Ottawa at every level of government, and we deliver benefits and programs that support a thriving business community. Never before has this been more important. Please visit our website for more information on our policies and member benefits. We're currently creating a special Ottawa reopening strategy with many free programs to support you, including our business insights, webinar series, business peer groups, and much more. There's also a new program coming next week called the Post Promise, People Outside Safely Together, and we are looking forward to launching that as well. We are very pleased to offer this workshop series along with our community partners, the City of Ottawa, Ottawa Public Health, and the Ottawa Coalition of Business Improvement Areas. I know that one of our BIA leaders is on our call today, so Andrea, thank you very much for joining us. And also thank you to Cindy Van Buskirk and Brian Simpson at the City, Phil Jansen at Ottawa Public Health, and Mark Koluski at Okobia, which is the Ottawa Coalition of Business Improvement Areas, for your continued collaboration and dedication to this community. We will begin with a short presentation and it'll be followed by a Q&A session. Our speakers today are representing Ottawa Public Health, and we're joined today by Joanne Murphy, who's Public Health Inspector, and Jacqueline Chalafou, also a Public Health Inspector. And I am going to turn it over to the Ottawa Public Health team now.
Hi everyone, my name is Jacqueline. Thank you for being with us today. There you go, sorry. So we're just gonna get right into the presentation. If you could hold your questions until the end of the presentation, it's a little distracting to sometimes see all the questions coming in. That would be great. So the purpose of the presentation today, I'm gonna provide an overview of the current status of COVID-19, discuss safe infection prevention and control practices, and review a safer reopening of personal services and discuss the common challenges that we are all facing. So a solid economy and robust social networks are important to the public's health. We know that work is a determinant of health. Social supports contribute to our well-being, our safety, and overall health. And a safer reopening is key to preventing or delaying a second wave. So safe here being the key word. We know that there may be a second wave coming, so if we could all do our part, then we could lower the risk. So what's the current status of COVID-19? The case counts are decreasing, hospitalizations are decreasing, outbreaks are decreasing. The numbers are going down, so that's really positive, but we still need to be safe so that way they stay down. Ottawa Public Health has a really good dashboard of how the cases are looking. So if you ever want to see how we're doing in Ottawa, definitely take a look at the Ottawa Public Health website. So we know there's challenges. The province has the authority to change what and when activities are permitted. Ottawa Public Health does not receive any advance warning of the provincial changes. So when you find out, we find out. And that doesn't give us a lot of time to kind of get things out ahead of time. We know that there's difficult scenarios that we need to deal with. There's a need for businesses and residents to continue to proceed with caution. So ensuring a safer reopening, everyone's business is different. Your layout is different. You know your business best. So it's important for you to follow all the available guidance on opening. Consider your physical space. Okay. You know your space, you know how much room you have. You know what your limitations are. Not everyone has a huge amount of space, and that's okay. There's still things that you can do. You need to protect your employees, protect your customers, and support the vulnerable customers and staff that you have. You need to communicate actively and effectively. There is, right now, the key focus is educate. We're here to support you on all the guidance documents that are out there. And, you know, once we educate, if education doesn't work, then there is enforcement. If you're looking how to, if you're getting call, you want to put in a call about enforcement, you need to defer that to bylaw, and you would just call 311. Okay. But we're going to go into detail about your physical space, how you could protect your employees, how you could protect your customers, how you could open safely. So general practices for infection control and prevention. You want to organize your work to reduce contact. So basically, in terms of your facilities, one of those ways that you could do that is to stagger shifts. So try and limit the amount of contact you're going to have with your customers. Okay. Take measures to reduce the risk. Ensure you and your employees are fit for work. If you're sick, you need to stay home. Even if if you're feeling just a little bit unwell, it's important to stay home to make sure that you're better. You should promote self-screening of all your staff. So they could go online, they could do a self-screening survey to check and make sure that they're okay. Practice and promote hand and respiratory hygiene. So as soon as customers come into your shop, they should be using hand sanitizer, as well as yourself. When you come in, you should be using alcohol-based hand rub. Okay. Enable physical distancing, crowd control, traffic flow, plexiglass, signage. There's a lot of things that you could do. Consider the flow of your workplace. There's visual cues that you could put on the floor. We're going to talk about those things in more detail coming up. You need to clean and disinfect. Cleaning and disinfecting are two different things. Cleaning occurs with soap and water. You're removing debris, and disinfecting is you're using a disinfectant. I've received a lot of questions being out in the field about disinfectants. We'll talk about those. Okay. Provide or mandate equipment. We're going to talk about personal protective equipment, but staff and customers need to be wearing a mask. A cloth mask is great. You need to be wearing it at all times, and we'll talk about personal protective equipment. So some of the common issues for personal services is general operations and physical distancing, operator and staff considerations, customer considerations, enhanced cleaning and disinfecting, and retail items. We're going to go into each one of these in more detail. So for general operations and physical distancing, like I mentioned, consider the flow within your premise and to encourage the 2 meter, 6 feet physical distancing. You could do this by visual cues, putting markers on the floor, trying to get your customers to walk in one direction and not overcrossing and not, constantly going by other people. Adjust your client appointments and staff schedules. Clients should be making appointments all the time, you should really avoid having walk-ins. If you do have customers that do walk in, ask them to go outside and call. You want to avoid having numerous people in your reception area. The main concept of COVID-19 is really just maintaining your physical distancing. So really keep that 2 meters distance and try and apply that throughout your whole facility. So if people are walking in, they're going to run into the clients that are into your premise. So just keep that in mind. It's a good idea to have a sign that says, you know, if you want an appointment, please call ahead of time. Declutter common areas for easy cleaning and disinfection. So remove items that you don't commonly use. So all your magazines, you should put them away for now. You don't want your customers to be, you know, touching anything. They walk in, they go to the station, you give them their service, and then they leave. So there shouldn't be any clutter around. Post signage throughout your premise. The signage can be found on our website at ottawapublichealth.ca. I believe Lynn's going to have some links for you at the end. Okay. Okay.
All right. Hi, everybody. My name is Joanne, and like Jacqueline, I am also a public health inspector. Just before I dive into the operator and staff considerations, I just want to make everyone aware that today we are talking about a general overview for all personal service settings, but if you are interested in service specific, you can visit our website, which we will have links to afterwards, and you can download. You won't be able to read it, but just to show you, we have checklists available that are specific to services. So we have one for tattooing and body piercing, one for nails and aesthetics, and one for hair salons and barbershops that just kind of dive a little deeper into potentially some more specific requirements for those services. So I just wanted to make you aware that today is going to be general, but for more service specific, please visit and check out those checklists. I think they'll be quite helpful. In terms of operator and staff considerations, these are a few things to consider when you are reopening. So scheduling of your staff. If you have a really large staff base and you're scheduling people, you know, half of them to start in the morning, half of them to start in the afternoon, think about cohorting. So always having the same staff members on the same shift. That way, if there is an exposure, the exposure is limited and it's not your entire staff being exposed at one time. We definitely encourage staggering lunch breaks and just your general breaks to avoid staff overlap. We want to avoid the potential congregation of gatherings, for instance, and just really encourage physical distancing throughout your entire operation, but that would also include during lunch breaks and just general breaks as well. One thing that we would want to also, as an owner, have you do is to ensure that all your staff schedules are up to date. So that's really in the event there is an exposure, there is an ability to make sure we have the most up-to-date staffing schedule of who was on site. So those are some things to think about when you're doing staff scheduling. Next would be screening of your staff before each shift. So on our website, we have a great resource tool that you can download and use for your staff. And we would recommend, and again, it will be a link that will be provided. It's also a link that's provided in the checklists that your staff can physically go to, click, and complete the screen. In the event they don't pass their screening, they should not attend your facility. They should either contact their family physician or visit our website for next steps and some further guidance. You definitely don't want staff to become ill. You definitely don't want staff to attend if they are ill. So you want them to be self-isolating at home and then following the next step guidance. Process for staff illness. It's always important to have a process in advance so you're not kind of caught off guard. So we would definitely recommend a process for staff illness. So if a staff becomes ill offsite, so at home, what are the steps that you as an operator are wanting them to take? And then in addition to having a process or protocol in place in the event a staff member becomes ill on site and starts having symptoms on site. So we would obviously, some things to think about are, ensuring that they exit and go home and self-isolate and follow up with their family physician or visit an assessment center to be tested. In addition, cleaning their workstation when they leave and making sure that you clean and disinfect it as well, which we'll go into a little bit in a few slides. So that's an important one. Hand hygiene is always encouraging hand hygiene. This is something that even pre-COVID we would want you guys to have in place anyways, but really encouraging hand hygiene, ensuring that workstations, entrances and exits have hand sanitizer available. We do recommend 70 to 90% alcohol based hand sanitizer, and really encouraging your staff to use it throughout the day.
Joanne, I accidentally muted you.
Oh, can everyone hear me now?
Yes, sorry about that. My apologies, everybody.
Sorry. Can everyone hear me? Can everyone hear me? Sorry.
Yes, we can hear you now, Joanne. Sorry.
Okay. So moving forward, so the process for staff illness, for hand hygiene, moving forward, just making sure that you encourage staff to use hand hygiene properly, as well as avoiding touching their face during services, and ensuring that if they are going to touch their face, that they perform hand hygiene prior to. So the final bullet is the personal protective equipment, which, as Jacqueline already noted, has been an item that we've received a lot of questions for clarification. And again, these checklists are going to be great because they go into further detail about the specific type of personal protective equipment based on services. But in general, masks should be worn by all staff for the duration of their work shift that are providing services. Okay, training obviously should be provided as well. And we do have some great links to Public Health Ontario that has videos for you to potentially provide to your staff on how to take off and put on masks safely, as well as other personal protective equipment. So just to, not to backtrack, but just to add, dependent on the service being provided, face shields or goggles would also be required in addition to masks. So masks should be worn for the duration, but depending on the service that you're providing, a face shield and or goggles would also be required to be worn by the operator or the staff member. Ensuring that hand hygiene is performed before and after PPE, personal protective equipment, is being worn is important as well to advise your staff, and making available to your staff as an owner operator that personal protective equipment is available. So making sure that you do have the appropriate equipment that's needed for the services being provided. So one other question that we kind of sometimes do or have gotten was about face shields being reused. As long as the face shield is being cleaned and disinfected, it can be reused, and we do want you to have a face shield or goggles, for instance. We wouldn't want you sharing that amongst staff, so it would be designated for one staff member. Do you want to flip it? So next is customer considerations. So with customer considerations, we have kind of highlighted 4 main areas. The first one being screening, and this is where we would want clients, when you're booking them, to screen to ensure that they don't have any COVID-19 symptoms or anything that would be flagging as a concern. For instance, have they been identified from public health as a potential contact for a positive case of COVID? Should they be self-isolating? So during booking, we do encourage, we would want you to screen individuals, and you can adapt from the ministry screening as well. Again, this is going to be a link that's going to be provided in our resources to screen. Jacqueline, during her portion of the presentation, did mention signage. Included in some of the signage that we have provided to our operators is signage about symptoms that you would put on your front door of your premise. And this is to ensure that people stop, read the sign before coming in to identify and ensure that they don't have any of the signs or symptoms of COVID. If they did, you would want them to obviously not enter, because we wouldn't want anyone who has any symptoms to come into your facility. So, and again, you want to make sure when they are coming to your facility that they haven't changed any of their answers from when you've booked their original appointment. So if they booked a week ago, you're going to want to touch base with them again, ensuring that things haven't changed. So when you're calling them, if they're sitting in their car and they tell you that they've arrived, you can call, you can say, you know, just touching base, none of your screening questions have changed, you're not showing any signs or symptoms, et cetera, et cetera. Okay. In terms of masks, it is recommended. We would want all clients to be wearing masks, the exception being children under 2. It's not recommended that they wear masks. And in the instance that a client isn't able to tolerate a mask for the duration of their visit, special considerations would be important to include. So for these individuals, you might think about making their appointments at the end of your business day and ensuring that other customers aren't around when they're having their service, as well as you would want to make sure that your staff, whoever's providing that service, are properly equipped with personal protective equipment when they're providing that service. Hand hygiene, we also want to really encourage our customers to perform hand hygiene at various points during their service. So obviously initially when they're coming into your facility, you would want them to perform hand hygiene. Depending on what the service they're getting, you would also. So for instance, if they're receiving manicures, prior to you starting your manicure on them, you would want them to perform hand hygiene. This could be either hand washing or using alcohol-based hand sanitizer. In the event hands are soiled though, you would want them to wash their hands prior to hand sanitizer being used. In terms of records, currently with our Ontario Personal Service Setting Regulation, it is for certain services, you already have to maintain records for your clients, but we do recommend now for all services that client records be maintained on site. So this would be included for booked appointments, as well as the potential people who are walk-ins, but they're not really actually walking in. They're calling, moments before they're getting their service. But we would want you to maintain a log of all people who have attended your facility. So this would include a full name, so first and last name, the or services, as well as the service provider. So you would want to make sure that the service, the staff member's name was also included. So next is our enhanced cleaning and disinfection slide. On this slide, I just want to make a really important point is actually the very first sentence, that our Ontario personal service setting regulation continues to apply for the cleaning, disinfection, and or sterilization requirements for tools, implements, and surfaces. So, you'll notice in our checklists and in our general guidance documents that it doesn't go into a lot of detail specific to equipment. And that's because the regulation still applies. So it's very important to be aware of the regulation and what level of disinfectant is required based on your service and your equipment that's being used. So in this area, it's very specific to surfaces. And ensuring that surfaces are cleaned frequently, especially high-touch surfaces, so doorknobs, debit machines, touch screens, light switches, items that are going to be touched multiple times. They may be required depending on if it's used by a client. For instance, a workstation chair where the client is sitting, that chair will have to be cleaned and disinfected after the client leaves, before a new client can come and sit. If it's just the general area, then at the end of the day, or more frequently if it's required. So if you're noticing that, people are touching a light switch more often, even including your staff to turn things on and off, you want to increase the frequency of cleaning for that piece of equipment or that surface. With cleaning and disinfection, Jacqueline already described the differences between the two. In order for a disinfectant to actually do its job and be good, it has to be able to have a clean surface first. So making sure that you clean the surface prior to the surface being cleaned and disinfected. Okay, some key items when it comes to disinfectants with COVID-19 is that you want to make sure that the disinfectant you're using, you can visit Health Canada's website to ensure that it is a low-level disinfectant or higher to kill COVID-19. You want to make sure it has a drug identification number or natural product number, that it's not expired, and that you're using it as per manufacturer's instructions. So wearing the appropriate PPE. So if it's corrosive, you want to make sure you're wearing gloves and wearing, if they require you to wear eyewear, etc. Ensuring that the contact time, so that's the time period that it remains wet on a surface, is maintained. So for instance, let's say you're using a Lysol wipe, you want to make sure that Lysol wipe remains wet for, if it says 8 minutes, the surface has to remain wet for 8 minutes for it to actually be effective. And then another item that has been something that we have seen as a concern is mixing of chemicals. So you want to avoid the mixing of chemicals. So you don't want to be mixing two different types of chemicals together. For instance, some people might use a bleach-based product and then switch over to an ammonia-based product, and potentially, if they interact, they can create a toxic poison that can be quite dangerous. So you want to really be careful of the chemicals you're using and making sure that you're using them properly as per manufacturer's instructions. Okay. And then the last piece is just is to encourage when you have a retail items or when people are paying for their service, to really encourage credit, debit, e-transfers with no signature transactions where possible. So encouraging avoiding money if you can. In the event someone is coming to your facility just to pick up retail products, ideally you want to arrange for a pickup or delivery time so that they're not overlapping with your in-service clients, if it's possible. And then removing testers. So we don't want communal things being available. Like Jacqueline said, removing and decluttering. So removing magazines, etc. So the same would go for removing testers, something that multiple people would be touching. You also want to avoid clients handling merchandise where possible. So this is where you might think about putting items in a display unit so people aren't touching it, that you as the owner operator or staff member, they're the ones who are going to be grabbing it for the customer and passing it to them for purchase. So just avoiding a lot of handling of products when it's possible. And then I think the next slide is just our resources. So our website has been updated with our most current guidance document, our checklists included. So please visit our website. It also has the contact information if you do need to contact Ottawa Public Health. And I think that's it.
Okay, that's great. Thank you so much. So I'm sure people have questions. So if you'd like to start putting them in the chat, we'll get to them one at a time. I'll just give Joanne and Jacqueline a moment to take a breather and maybe get a drink of water. It's hard work trying to deliver all of this information on a Zoom call. So while we're waiting for people to, oh, there we go. We've got our first question. It's in regards to wearing face shields, goggles, or eyeglasses. When required, if eyeglasses are already being worn, do staff need to double up if already sporting a mask as well? So I think the scenario is that somebody is wearing glasses and they're wearing a mask. Do they need a face shield on top of that? Who wants to tackle that question?
Do you mean like prescriptions glasses?
Tanya, you can unmute yourself if you want.
Hi, ladies. Yes, exactly. I've got quite a few that wear prescription eyeglasses already. So my question is, for the hair department specifically, or doing a manicure, do they need to wear goggles or a face shield over the eyeglasses and the PPE cloth mask that we've provided them? Because it just seems like a lot and they're getting hot.
Yeah, so yeah, even though you have prescription eyeglasses, you still need to wear either the visor or the goggles. The goggles cover the side where the glasses allow for that space. So what we're really trying to avoid is having any droplets come into that space beside your glasses. So that's why there's the face shield or
Okay.
the all the way around.
Okay, no, I get it. I just wanted a clear kind of ruling on that one. Thank you.
Interestingly enough, we have an optician in the audience today, and she had put in the chat for us, this is Sylvie, regular eyeglasses are not meant to protect the eyes. So there you have it. Our next question comes from Michelle, and she's asking about the protocol when a client says they have had COVID. It's an interesting question. I'm presuming, Michelle, that you're asking about doing a screening survey with a client as they arrive at your premises and they say, no, it's okay, I've had it already. Is that what you're asking? Yep, Michelle has answered yes, that's what she wants to know. You know, do you take people at their word? What do you do?
So in terms, I've got a little bit of echo here. In terms, I'm just going to let Jacqueline turn that down.
There we go.
In terms of a confirmed positive active case, they should be following their case management direction. So if they're saying that they are allowed, they're completed their isolation, then that's what they've been directed, that they've been isolated for the time period of concern. Their Ottawa Public Health or the health unit that they reside in has given them the okay to leave self-isolation and to continue on. Then that's the direction from public health, and they can partake in routine, regular tasks and services, etc. I don't know if that answers the question.
Well, I'm wondering if Michelle's concern is about people who are saying that they've had COVID and don't need to wear PPEs. We certainly see evidence of behavior like that in other countries. Certainly if you go online, you can see people, I don't need to wear anything, I've had COVID before. Michelle, is that more what you were thinking, or were you just looking for general direction as to whether or not it was safe to have previous patients in your salon or business? So just waiting for Claire. Oh, there we go. Oh, no, Michelle just wanted to make sure it was safe to let them in if they had COVID in the past.
So just to add to that, you are going to want them to have a mask as well, just like you would treat everybody else. You would want them to be masked if possible, if they can tolerate it, and if they're not under the age of 2.
Okay, we have 2 similar questions that have come in from Maureen and from Tanya, and they're both regarding PPE for front desk staff reception. Maureen specifically wants to know what type of PPE you would recommend, and Tanya would like to know if they're sitting behind a large plexiglass shield and not performing services, do they need to wear a facial mask at all times? So I think if we can break that into 2 pieces, the first question would be, do you have a specific recommendation for front desk staff in terms of PPEs?
So this is where our checklists are actually going to come in handy for services. If there is a plexiglass in place and 2 meters, so 2 meters can be maintained during their reception duties, and if there is that plexiglass barrier, then the receptionist is not required to wear a mask. In the event they are doing any portion of a service, though, they do. So sometimes in certain instances, a receptionist will double as they'll be doing cleaning afterwards, after service, that they would have to wear PPE at that point. But if in the event they're strictly sitting at the reception desk greeting people and there is that plexiglass, then no, they would not be required.
So our next question is from Maureen, and she would like to know, is there any special requirements, such as new regulations or specific PPE, for body treatments like relaxation massage, scalp treatments, or body wraps?
Oh,
So it seems like these services are quite personal.
it would be the same idea where you're wearing PPE. You have to wear a mask. There's no treatments to the face, so I think that would be. I would There's also more details about that on the checklist that talks about massages and what's allowed, what's not allowed, and what PPE you're supposed to wear. Regardless, you're always going to be wearing a mask. So where is that?
Does that answer your question?
Did that answer your question? So it's not specific to relaxation massage, it's more aesthetics. So you'll see it in the aesthetics checklist.
Great. So our next question, this is a great question. This is from Carolyn. We had guests show up to their appointments in scrubs coming directly from a healthcare setting while they were working. And the employees were a little uncomfortable with this, and she wasn't sure how to handle it. The guests were wearing masks, but you know, what do you do when somebody's come directly from working at the hospital and they're still wearing their work scrubs?
That's a good question. Really, it's your workplace, so you need to feel comfortable in your workplace. This would be a good opportunity to bring that up in your screening when you are talking to them over the phone, to say, you know, if you work in a healthcare setting, please change before coming. You could always ask them to go change and come back. It's really what you feel comfortable with. Ideally, you don't want them wearing their work scrubs and coming into your premise, because we kind of say that for you as a staff member as well, right? Like to wear an apron or to wear some type of covering, so that way you could protect your clothing and protect yourself. So it's the same idea.
So just building on that particular question, would it be reasonable for Carolyn to offer a smock or cover up to those people showing up in a scrubs? Would that have any benefit at all?
I think it would have some. You'd have to launder it right after, and just keep in mind that, you know, then you're handling it. So to wear gloves and to wear appropriate PPE when you're doing that.
That's great. Next question was about sharing the specific OPH links. So I'll just remind everybody that within a few hours after the conclusion of today's workshop, we'll be sending out a follow-up email that has a link to the recording, and we will have all of the links from OPH in that email for you, so that you don't have to go hunting for them. Next question is from Michelle, and Michelle operates a salon spa. She wants to know if you should avoid blow drying clients.
Okay, so in terms of blow drying hair, you would want to make sure you don't have to avoid blow drying. You can blow dry hair in the event that all of your clients and all of the staff members are wearing masks and appropriate PPE. So you can have your hair dried by a blow dryer in the event that everyone is wearing a mask. You can also do the same for, I was assuming she was talking about hair, but in terms of nails, if you're wanting to dry nails, you can also do that as long as people are wearing masks as well. Both clients in the area as well as staff in the area. And ensuring that the nail dryer is clean and disinfected between each client.
So I'm just scrolling backwards. I missed a question earlier from Cheryl, and Cheryl had a client come in that works at a COVID clinic, and a couple of her staff were very nervous, and understandably so. What can she say to them or tell them to reassure them that they're safe?
So I understand that everyone's nervous during these times of COVID. This is why you're wearing PPE, why it's really important to wear a mask. You really do lower the risk when when you wash your hands, when you use alcohol-based hand rubs and you wear a mask and your customer wears a mask. If the staff and the customer are wearing a mask, you really are decreasing the risk. So I think I would tell my staff, follow the safety procedures, wear your PPE, make sure you're washing your hands, that you're using your alcohol-based hand rub, that you're screening your customers. These are all really important steps to lower the risk.
Is it safe to presume then that if Cheryl's client worked at an Ottawa Public Health COVID clinic, which I presume they run all of them, that it's a no-brainer that OPH staff would be following all of the most strictest rules and guidances for cleanliness? Is that right? Please tell me that's right.
For sure. Everyone at Ottawa Public Health, is aware of what they should be doing. We obviously can't speak for everyone, but it's out there in the news. We know that we should be wearing a mask, and you hear about it every day. So I would like to think so.
Thank you.
I'd also add that at the clinics, they do have infection prevention and control measures in place too. So at the actual clinics themselves, they're following strict guidance and requirements from an infection prevention perspective as well.
So I just would like to hop in here and share something for Cheryl to help her. My husband had to get a COVID test yesterday afternoon at Brewer. And, he, other than the wait time, which was significant, but it was very, very busy. And thank goodness that we have testing centers and people are getting tested. But he said that, they did a great job keeping everyone distanced. He was wearing a mask the whole time. Everyone that he dealt with was wearing a mask and was adhering to all the procedures that we hear about. So I personally would feel very comfortable saying to my staff, if someone was working at an Ottawa Public Health clinic and came in, that you could rest assured that they had been practicing the right procedures. So I just wanted to share that because I'm not with Ottawa Public Health. So, it's kind of a third party comment. So we have a couple more questions that are coming in. And he was negative, by the way. Thank you so much. I was very grateful for that. Whew. Dawn would like to know if you could please clarify when to wear a face shield. Do the handheld face protectors count for covering clients during shampoo instead of a face shield for the staff? Dawn, are you referring to those handheld, the little things you hold up and it's almost like on a stick, more for protecting your face from getting hairspray or something? Is that what you mean? Yeah, that's what she's talking about.
Yeah, so I think that's fine. Basically, as long as either the customer or the staff is doing the face shield, then at least one of you guys is protected. So you just want to make sure it covers the whole face, and that works. What do you think, Joanne?
Ideally, it's
Unmute yourself.
So you would just want to make sure, I'm not familiar with the type of protector you're referring to, this handheld face protector. You want to make sure it's an appropriate PPE though, that it's meant to properly shield droplet, like respiratory droplets. So you know, this might be one that you might want to connect with Ottawa Public Health directly with, so that you can either send us a photo of what you're talking about. For clarification's sake, I think that might be best, because I'm not really 100% familiar with this handheld face protector. I don't know if that answers your question specifically, but.
Yeah, because if it's just, face shield, as the regular face shields that you usually wear for personal protective equipment, whether, if the staff, rather the customer wear it, then it's appropriate PPE. So it really depends what you're talking about. We definitely would have to see it.
So Dawn has also commented that the client would be wearing a mask as well. I know exactly which piece of equipment Dawn is referring to, so I will send you both a visual when we get off this call, and then maybe you can connect with Dawn or share some feedback, and I'll get back to her.
Yeah, I have your email, Dawn. I could email you. We spoke over the phone a few times.
We have another question and this one is from Shanna. Shanna works alone. She has no staff, and she does 1 pedicure a day. She has a 2-seater fabric sofa, and she has a vinyl cover on it right now. If she seats one client on one side on day 1 and another client on side B on day 2, do I need the vinyl covering, which is disinfected, since there will be 48 hours between clients sharing that seat? Shanna, you can unmute yourself if you want to elaborate or clarify.
So you would want cleaning and disinfection of your workplace to happen at the end of the day. So she would still need to clean and disinfect that vinyl cover at the end of the day.
So what I'm doing right now.
Does that answer the question? Does that provide clarification?
Can you hear me?
Yep.
Okay. What I'm doing right now is disinfecting, like I'm spraying it. I use preempt, so it stays on for 3 minutes, and doing that after the client, but I don't have somebody in that particular spot for 48 hours because I have 2 spots, but only do 1 person per day. So wondering, because I have a client that works at a consignment store, and any clothing that gets tried on that they want to put back on the rack right away, they were told to leave it for 48 hours or you steam it so it can go back right away. So I'm just wondering if the 48-hour rule would apply for a fabric sofa if the client's clothing basically is the only thing touching that sofa, that seat.
So you'll still want to have, like, all surfaces in personal service settings to comply with the Ontario personal service setting regulation are actually not, they're supposed to be cleanable, non-porous.
Mm-hmm.
So the fabric sofa is something that in terms of our personal service setting regulation wouldn't be in compliance with, as it's porous and is fabric based and not easily cleanable and disinfected. So I would continue with your vinyl covering and cleaning and disinfecting at the end of the day or in between clients if you for some reason have a client, for some reason 2 clients that day, for instance.
Okay, sounds good. I'll leave the vinyl on.
Okay.
Okay, and now we have a question from Sylvie. And Sylvie's work environment is a little bit different. She's a mobile optician. So she wants to know, could you please confirm that all these requirements are for indoor work only? Outside work, like a mobile curbside service, doesn't need as much PPE. Is that correct? My regulatory board currently doesn't allow us to touch the patient regardless. All tools, equipment, and surfaces are still cleaned and disinfected. And Sylvie does not have a microphone, so Sylvie, keep posting if you have follow-up questions. So it's a mobile optician service, and she's wondering about, last.
I'd have to say that that is a case-by-case basis. It really depends what you're doing. I would say I would take that offline if Sylvie could just follow up with a little bit more detail about what her services that she does provide. I would have some questions. She could just follow up with me directly.
Okay, great, thank you. And Sylvie has acknowledged that she will most certainly follow up with you, and thank you for that. So it looks like we have addressed everybody's questions that I've seen posted. And we have about 5 minutes left to go. Does anyone have a last minute question that they want to put to our team from Ottawa Public Health today?
Lynn, I do notice that there is a question about capacity from Michelle.
Oh, yes, I'm sorry. Thank you. I saw that too.
There isn't really a rule about capacity. It's more that you're wanting to maintain the 2-meter distance, and that's the important part. So if you look at the checklist, it does talk about, it's really about your social distancing.
Did that answer your question? I think that was coming from Michelle. Yes, okay, good. So we answered Michelle's question. Lovely. Here's another question. Would you have or know anyone that could come into my spa to speak to my staff about being in a safe work environment to ease their anxiety? Joanne, you're still muted.
She's reading the question.
Oh, I'm so sorry.
I wouldn't say we. It's a really good question. I would say Jacqueline and I wouldn't be able to identify staff members right now due to work capacity at Ottawa Public Health, but maybe connecting with Ottawa Public Health for that request, and we can bring it forward for sure to see if there is capacity for somebody to provide that like a presentation or a one-off meeting with staff. It would have to be something that would be brought forward for sure.
Cheryl, was your interest in having someone come and just clarify that yes, this business is following the right procedures and it's clean, or is your interest more in someone who will come and help them manage and deal with their anxiety? Oh, sorry, Cheryl. I just wondered if you were more interested in having someone come and sort of reinforce to your team that yes, your salon is following all the right procedures and that there's no reason for your staff to be concerned or be anxious, or were you more interested in having someone come and talk to them about managing their anxiety while they're at work? Did that make any sense?
Yes. Sorry. Can you hear me?
Yes, we can.
Okay. Yeah, I had 2 girls really nervous, going back to my question about the COVID nurse coming in. And so, I mean, managing, just two of them were a little nervous about it. So I thought, it would be a good idea to have some, like a nurse to come in or someone speak to them just to ease their anxiety. I have one girl that's really nervous. So, and I've I mean, I feel like I'm doing everything to protect them, doing even more. Like they have options of PPE and stuff, but I'm having trouble like easing that anxiety completely with one or two of them.
So I would say, Jacqueline and I can take that away for sure, and bring that up to our management. There is also some really good resources that Ottawa Public Health has on mental health, of anxiety, and concerns surrounding COVID specifically. So I can connect with Lynn those links to our website. And I believe it speaks also to employers with employees' anxieties. So we can definitely connect you with those resources. You might hopefully find them helpful with staff anxiety, for sure. I can connect you anyways, Lynn, with those.
Okay, that's fantastic. And the more resources Cheryl has, the better. I'd also like to share with everybody that a couple of weeks ago, the Ottawa Board of Trade did a Wellness Wednesday webinar with Dr. Nicole Loretto from the Royal Ottawa Mental Health Center. And the topic was returning to work anxiety and understanding and managing it. That webinar has been posted on our website. And you'll get that link when I send it, the recording link for today. So I invite you to combine the information that you're getting from Ottawa Public Health with Dr. Loretto's messaging, and that might help you as well. We have time for a final question from Michelle, and she wants to know if plexi barriers will allow for clients to sit closer than 2 meters apart.
Yeah, so if you look in the checklist, it does mention that the plexi barriers do provide a barrier. So keep in mind that even if you have the barriers in place, you are able to have an increased capacity, but you still need to wear masks. Your customers still need to wear masks. And if you have more people in your establishment, really think about how that's going to affect your flow. If you have too many people in, they're going to be crisscrossing when they're coming in and out. So be very vigilant of if you're increasing your capacity that you're going to have some flow issues potentially. And regardless, everyone needs to wear a mask.
All right, so we've just gone slightly over time, and it looks like we've answered everybody's questions. I don't see anything further popping up. So I want to take this opportunity to thank Ottawa Public Health yet again for offering this industry-specific guidance. I'm sure it's very helpful to everybody. Everyone seems to have tons and tons of questions. We will be sending out a link to the recording when it's live on our website. And again, I invite you to watch it as many times as you like, and definitely share it with your staff, your team, your colleagues to make sure you cannot spread this message too far. And thank you so much for joining us today. Have a great afternoon, and we hope you have a safer reopening. Have a great day, everybody.
Thank you.
Thanks.